Hola, buenos días, buenas tardes a
Good
todos.
morning and good afternoon, everyone. Welcome to the press briefing of the Pan American Health Organization, PAHO. Today is Wednesday, March 16, 2022. My name is Luciana Viegas, Public Affairs Advisor. Today, as always, we will have simultaneous interpretation into English, Spanish, French, and Portuguese, and you will be able to ask questions through the Q&A button. We've received some questions already via email. Thanks to all journalists who sent their questions in advance. Please, when you put your questions on the Q&A, identify yourselves with your name and outlet. Today, Dr. Jarbas Barbosa, Assistant Director of Pan American Health Organization, will give you an update of COVID-19 in the Americas. Dr. Barbosa is joined by Dr. Ciro Ugarte, Director of the Department of Health Emergencies of PAHO, and Dr. Sylvain Aldhigieri, Incident Manager for COVID-19 in PAHO also. Over to you, Dr. Barbosa. Thank you, Luciana.
Join today's press briefing. Weekly COVID-19 cases in the Americas reached 901,000 last week, a 19% overall decrease compared to the previous week. While most parts of the region showed decreases, in the Caribbean and Atlantic Ocean islands, cases increased by 56.6%. Weekly COVID-19 deaths also fell, with 15,523 new deaths reported, an 18.4% decline. All parties of the region reported declines in deaths, ranging from a 6.9% drop in the Caribbean to a 27.9% decrease in Central America. COVID-19 infections and deaths are declining in most of our region, but there are still too many cases and deaths being reported every day, a clear indication that the transmission is not yet under control. Since the virus arrived in the Americas 2 years ago, 149 million cases of COVID-19 have been reported and 2.6 million people have died. Cases are rising again in other parts of the world, serving as a cautionary tale for our region. Cases increased by 28.9% in the Western Pacific region, by 12.3% in the Africa region, and by almost 2% in the European region. This virus puts us all at risk, especially the unvaccinated. That's why we must continue our efforts to close the equity gap and protect the most vulnerable with COVID-19 vaccines. Over the course of the pandemic, vaccines have been prioritized by presidents, ministers of finance, and other decision makers, and they've been embraced by the public. Now, many countries and territories are on track to reach the 70 coverage target by June of 2022. 80 countries and territories have vaccinated more than 80% of their population. Others are not far behind and have been making steady progress. But we still have a lot of work ahead to improve our resilience to COVID-19. 21 countries and territories have yet to vaccinate half of their population. And even in places with high overall coverage, some of the most vulnerable, such as the immunocompromised and the elderly, have not yet been protected, leaving them and our health systems at risk. As we continue to expand COVID vaccine coverage, we must also improve the following coverage of other vaccines. Our health systems have been concentrating on the pandemic response, but they also need to maintain their focus on routine immunization, which prevents other serious diseases and saves lives. Vaccine coverage for polio, measles and rubella, diphtheria, and other childhood diseases had been falling even before COVID struck. The heavy impact of the pandemic only made this worse. In 2 years, we've rolled back nearly 3 decades of progress on polio and measles, putting us back to the same vaccination levels we had in 1994. In parts of Brazil, we have ongoing outbreaks of measles, a disease our region had once eliminated, despite the great efforts that the country is making to interrupt the circulation of measles. And once pervasive diseases such as diphtheria and yellow fever threaten to resurge unless we act quickly. While we have no active polio cases in the region, recent cases in places like Israel and Malawi serve as a dire warning for the threat we could face if we don't bring coverage levels back up soon. HPV vaccination, which prevents cervical cancer in our young women and girls, has also stalled across the region due to school disruptions. COVID-19 showed us once again that vaccines are the most important tool to control infectious disease and save lives. We need strong political and technical leadership at the national and local levels to raise vaccination coverage against each disease, building on the rapid rollout of COVID-19 vaccines. Sustained investment and commitment at the highest levels helped us get COVID vaccines into millions of arms. They are also key to protect our children, family, and friends from vaccine-preventable diseases. Countries are already beginning their work to make up for lost progress. Many countries restarted campaigns against measles, rubella, and polio in 2021, and at least 80 countries are already planning to do follow-up measles campaign this year, aiming to protect more than 67 million children against this virus. As we have done for the past 20 years, we will work with countries across the region to run coordinated national campaigns during vaccination week in the Americas to catch up all persons, children, adolescents, and adults on their missed vaccines. This is a reminder for countries to continue strengthening their national immunization efforts. The PAHO revolving fund will continue to support countries with the purchase of routine vaccines, just as it has helped secure deliveries of COVID-19 vaccines. We can leverage COVID vaccination efforts to deliver all the essential vaccines. PAHO's investment in expanding access to COVID-19 vaccines, made with the financial support of the United States and Canada, are supporting countries to strengthen their cold chain and logistic efforts. Countries like Mexico are repurposing their COVID-19 vaccine infrastructure to expand routine immunization against measles and rubella. In the Southern Hemisphere, influenza season is starting. We encourage countries to offer flu and COVID vaccination at the same time, so they can protect the people against two diseases at once. And we must remain committed to getting COVID vaccines to all those who need it. As countries work towards the 70 coverage goal for COVID vaccines, they must ensure they are reaching the right groups, especially the most vulnerable adults. Countries should make decisions about COVID-19 vaccination policies based on scientific evidence. This means keeping their focus on the elderly, healthy workers, and other high-risk groups, even as vaccination rates rise in the overall population. They must work with local leaders and organizations to tailor their communication campaign towards communities' concerns and close the gaps that remain. Countries like Ecuador, Colombia, Paraguay, Brazil, and others have successfully expanded the vaccination coverage in their indigenous population, thanks to deep partnership with trusted local leaders. Rebuilding the strong backbone of immunization programs that can sustain high coverage is essential to securing our children's future and allowing our region to flourish. countries can take advantage of the momentum from the COVID-19 vaccine rollout, which saw 675 million people trusting vaccines and completing their schedule to protect against disease and death. We cannot waste time. We have the experience, tools, and know-how to catch up on missed vaccinations, prevent diseases, and protect our families today and in the future. We invite the country's leaders to build a political commitment to solid, equitable immunization, focus on routine programs that include the COVID-19 vaccine. It's up to all of us, parents, health workers, communities, donors, and governments to sustain our commitment to the life-saving power of vaccines. Thank you.
Thank you, Dr. Barbosa. Pasamos ahora entonces a las preguntas que los periodistas nos han enviado con antelación y recordamos que pueden hacer preguntas a través del botón Q&A.
You can ask your questions now through the Q&A button, and now we have our first question in English.
50% of COVID vaccinations. Are people in this country reluctant to take the vaccines? Dr. Barbosa.
Thank you for this question. I think that we have at least three important reasons to explain why some people are still reluctant to get their vaccines against COVID-19. In the past, we had the access to vaccines as the main problem, but now I think that these three causes can explain a lot. First, some countries and territories in the Caribbean, for instance, they have not been experiencing a very important community transmission with high mortality rates. So the risk perception in some communities are low than in other parts of the region, such as in Latin America. In Latin America, almost every family has lost a member or knows a friend, a neighbor that has lost their life or that have had a very severe disease. In some countries and territories in the Caribbean, the risk perception is different. The second is that we have some vaccine hesitancy movements around the countries, the families, the communities. Some people, I think that they are easily targeted by anti-vax fake news. They need to receive more transparent, objective information about the vaccines so they can be sure that they are getting a safe and efficacious vaccine that can save their lives. And I think that the third reason is also the what we call absorption capacity. Now, in some countries, and PAHO is working very hard with the Ministry of Health to increase their capacity to receive the vaccine through COVAX, through donation, and through other sources, and to use them and to offer them at the local level, at the health facilities. So the combination of these three causes can explain why some countries and territories are still struggling to get the vaccine coverage over the 40% target. That was the goal for the end of 2021, and to reach the 70% goal that we want to reach by June of this year. PAHO is working with the Ministry of Health, and we do believe that we can, based on the good experience that you have in each country, to develop strategies and initiatives that can overcome these very important barriers and get people vaccinated. Thank you.
Thank you, Dr. Barbosa. Pasamos a una pregunta sobre el aumento de casos.
Now I have a question about one from Doris Pantaleon, Listing Diario from Dominican Republic, and a similar question from Violeta Vilar from the Web de la Salud. And the question is, we want PAHO's opinion about what is going on in China with COVID-19. What recommendation do you give us here for the Americas? So do you foresee a recrudescence of the virus? Could this affect other nations? And does PAHO have any knowledge about what variant is affecting China at present? Dr. Aldhigieri, please. Thank you for your several questions. focused differently. So during our press briefings here, we have been reminding the journalists that the global and regional situation of COVID-19 continues to have many and large uncertainties. There are several countries in Asia and Oceania where there have been increases in cases. There's Hong Kong, Singapore, New Zealand, in addition to China. In several European countries, there are some increases again in the number of cases. The situation in the region of so-called Western Pacific, which includes China, has reported in general an increase of almost 29% in the number of new cases and an increase of deaths in over 12%. And this is the region of the Western Pacific. The impact of these increase in cases in both cases and deaths varies very much from country to country, depending on the vaccination coverage. It depends on the risk groups and age groups and their vulnerability to the disease. So if we have homogeneous vaccination rates with full schedule with boosters following national standards in priority groups continues to be the most important measure to avoid the severity of the disease brought about by an increase in cases. A scenario of recrudescence of the situation at subnational level and at national level, or even in a whole region or sub-region, is a scenario that should always be on our epidemiological radar. An increase in circulation of the virus may be related to unknown variants of the SARS-CoV-2 virus, maybe Omicron, or maybe it could be the emergence of a new variant of concern. In the current situation regarding transmission profiles, both globally and regionally, measures need to be in place available to health authorities to maintain sustained control of the disease. Now to the second part of your question related more to the molecular aspects and genetic aspects of the virus. Both in China and in the rest of the world, the Omicron variant is the predominant one nowadays. However, in Asia, they have been able to establish that there's a sublineage, the A.2 subvariant in 69% of sequences reported on the public database called GISAID, as opposed to the Americas, where the sublineages BA1 of variant Omicron are predominant in over 95% of sequenced and published samples. So it is important to remember that even though there are some differences, genetically speaking, between those sub lineages of Omicron, there is no evidence showing an impact on transmission. There is no change in clinical manifestations of the disease, and all control measures, all the non-pharmacological control measures, including a full vaccination schedule, continue to be highly effective. Thank you. Thank you, Dr. Aldhigieri. Now I have a question from the Caribbean in English. So actually two questions.
Boleg from the Tribune in the Bahamas. I will read and we answer the first, and then I will read again and answer the second. The first is the COVID cases are decreasing in the Bahamas, and recently we experienced further relaxation. Individuals are not required to wear a face mask while in a lobby, corridor, or casino of a hotel, or while in an outdoor setting where there is at least 3 feet of space between persons who are not of the same household. Does the data and health system capacity show that the Bahamas may be ready to remove the mask mandate in other establishments or outside in general? So a question about mask mandates, Dr. Ugarte.
Thank you, Luciana. Thank you, Ariel, for this question. Well, in the case of the Bahamas, the national authorities and the Ministry of Health is taking into consideration several criteria to update the public health and social measures, including the number of cases, the number of new cases, the number of new deaths, but also the availability of healthcare and hospitalization beds and ICU beds for symptomatic patients. But also they are following what are the vaccination coverage rates, as well as what is the situation of the epidemic situation in the countries or places of origin of the visitors. So all these features are being analyzed, and the government is taking the approach following the recommendations of WHO and PAHO regarding how to adjust the measures according with the situation. So in that regards, we consider that these adjustments must come in a dynamic situation. We know very well how very low trends of new cases may lead to increase of cases if the measures are not followed by the population. And it seems to be the case in several parts of the Americas. And also we know that what's happening in other regions. So in that regards, we would like to highlight that in the Bahamas, for example, the measures for festivals are still in place. So the Ministry of Health is advising and finally approving some festivals or public gatherings based on certain standards. So this is something that will be followed in the future. So this is a recommendation actually for all the Americas. And in the case of the Bahamas, these adjustments must be dynamic in the context. So we shouldn't be surprised that some of these measures are relaxed and then come back and also be applied in certain areas of the country and not necessarily in the entire country in all territories that are in this context. Thank you.
Thank you, Dr. Ugarte. The second question from Irio is the World Health Organization, WHO, said Sunday it is concerned the war in Ukraine could worsen the COVID-19 pandemic and is trying to do more to limit the spread of infectious diseases. How will this affect the Caribbean region, and has inflation already hit the medical system, for example, medicine, equipment, receiving healthcare services, thus potentially impacting in the fight against COVID-19? Dr. Ugarte.
Thank you for this question again. There are two parts. One is in the introduction for the question, and it is related with the concern of communicable diseases or worse in the COVID-19 pandemic. And this is something that is related with the population that is leaving Ukraine to other places. And as we have seen in several other occasions, this population are in higher risk. But regarding what is the impact in other regions, and especially in the Caribbean, there are some clear indications that the freight costs, both by sea or by air, are increasing on a daily basis. For example, a shipment from Asia to the Americas West Coast has increased 2% in one day. And now the cost is 196% more or higher than the same time last year. And regarding the air freight costs to the East Coast, so the Caribbean and other areas of the East Coast of the Americas, it is even higher. So the cost now is 241% higher than the rates to this week last year. So these are the type of aspects that we are concerned about, but also not only the freight costs, but also the availability of certain supplies that are coming from that region. And of course, you know, the high demand of personal protective equipment and others, particularly in the Asia region, may also impact on our region. So some of those aspects are being monitored, and this is probably a time to consider looking at good procedures in our region, for example, look into the revolving fund or the strategic fund in the Americas that may support the countries when these costs are moving higher. Thank you.
Thank you, Dr. Ugarte. A follow-up question about the rising cases in the Caribbean region, while other regions had decreases. Would we be able to give more details on these increases? Dr. Aldhigieri, please.
Yes, thank you. This question, this follow-up question is in the same context as my comments and my answers for the question from Dominican Republic with the high complexity and of the mosaic of different patterns of transmission in different between different regions, between sub-regions, between countries, and also within the same country. In the sub-region of the Caribbean, although cases have been declining for 7 weeks, during the last week, we detected an increase of new cases of 50%. This is an increase Caribbean-wide when we put together the data from all Caribbean countries, with 12 out of the 31 countries and territories, important mentioning territories, showing an increase in new cases. As an example, the French Department of Martinique has reported through its official bulletin from the Institut de Veille Sanitaire, 170% increase in new cases. However, they have noted that deaths are still decreasing in this French Department of Martinique. So this question gives me the opportunity to flag that in the Caribbean, efforts are still needed for, one, improving the vaccination coverage in groups at risk and in young adult population, including rolling back the vaccine hesitancy. And second, always consider the use of public health measures and personal protection measures, including wearing masks, as the SARS-CoV-2 virus is still circulating at the moment in almost all Caribbean countries and territories. I hope that I have answered the concerns transmitted through this question. Thank you.
Thank you very much, Dr. Aldhigieri. Pasamos a una pregunta sobre desde Guatemala.
We now move on to a question from Guatemala. Daniel Connell from TN23 Guatemala is saying, Guatemala has started to vaccinate children between 6 and 11 years of age, and they're hoping to vaccinate 2.2 million children. How do we assess this step, given that the protection measures by the rest of the population have diminished? Dr. Barbosa. Thank you very much for that question. Here we have two different types of measures. Protection measures within the population have to follow the recommendations by the Ministry of Health that is constantly assessing the epidemiological phase and also transmission in the community. It is always very important to remember that the pandemic is not over. It is very important to maintain individual protection measures. The other issue has to do with vaccination, as I mentioned at the beginning, and I always say we need to follow a strategy based on scientific evidence. All of the evidence that we have from the countries show us that all of the most vulnerable groups to develop a severe form of COVID-19 that would require hospitalization or even the risk of death due to the disease are in the elderly, individuals who have some sort of chronic diseases, diabetes, hypertension, individuals who have some sort of immune problem. So those groups need to attain the highest coverage possible because that's when the vaccine saves lives. As for the other adults, it is an important group that includes healthcare workers to maintain hospitals and also services within the hospitals. The other groups also need to be vaccinated, but we need to follow all the steps that we already have in the vaccination or immunization plan. Once we have the proper vaccination supply, the next step would be to offer the vaccine to children. First, they need to be approved by the national regulatory authorities. And second, we all need to guarantee that this can be done continuously in detail to offer vaccination first to the other priority groups. And we're not talking only about the first dose, but the full schedule to identify where the elderly lie, and also individuals who have immunocompromised systems who are still waiting for the second dose. So this is a strategy and that requires analysis and the inclusion of all of the measures so that in an equitable and homogeneous way, all of the steps for immunization can be implemented. It is a good idea to have vaccines available for boys and girls whenever possible, but it is also important to guarantee that the most vulnerable groups are vaccinated first. Thank you. Thank you, Dr. Barbosa. Now we move on to a question from Mexico. Javier Hernandez Garcia for Telesur Mexico is asking, are we prepared to start relaxing health measures imposed by health authorities? And second question, what is the current situation of vaccination in the rural areas? Dr. Aldhigieri. Thank you for those questions from Mexico. I think it is important to frame my answer given the epidemiological situation in Mexico. Even though in Mexico we continue to see over the last 7 weeks a continuous reduction of COVID-19 cases over the last week as compared to the previous week, the decrease was below 18,000 cases, below 30%, and 180 deaths less. And also the hospital occupancy went down to 14%, and to ICU beds, it went down to 8%. So we see a continuous decrease of the number of active cases, and 17,500 active cases were reported. That means that there is a difference of minus that is lower to or below 24%, and 31 entities in Mexico have a low traffic light system for the epidemiology that is green, and only one has intermediate risk, yellow. And clearly, these are the criteria applied by the General Health Secretariat that is reporting to us on a regular basis based on their risk assessment. As I have indicated when answering the question about the Dominican Republic, given the instability of the international situation and also the surge in the number of cases in the Pacific area and other areas of Asia, and also the clear possibility for the appearance, the emergence of new variants of SARS-CoV-2, the recommendation is not to relax non-pharmacological measures in the country. And there is also a recommendation to guarantee access to COVID-19 vaccines for the population that doesn't have the first dose or booster, to also promote vaccination for a vulnerable population, and also to convince those that have not been vaccinated. That takes me to the second part of this question, which is the current situation of vaccination in rural areas in Mexico. We can say that the vaccination coverage in the urban areas, and in particular in large cities, reaches high and very high levels. For example, in the city of Mexico, we have almost 100% coverage. This is data published by the Secretariat of Health at the federal level that shows state-by-state coverage. On the contrary, vaccination coverage in 3 rural states, and this is the question by our colleague, and densely populated areas such as Chiapas, Guerreros, and Oaxaca that have high density indigenous populations, there is a need to continue to underscore the benefits of vaccination to protect those populations against hospitalization and severe disease, and populations that are highly vulnerable, such as indigenous populations. I think that with those two comments, I have addressed the questions from Telesur. Thank you. Thank you, Dr. Aldhigieri. We move on to a question by Sami Paula Martinez, a journalist of Transparency Venezuela. Two questions. The first one, what is the cost of the 6.5 million doses of COVID-19 vaccines to be sent to Venezuela by COVAX? And a couple of weeks ago, PAHO reminded us that Venezuela had a debt with the revolving fund. What is the current situation? Have the commitments been fulfilled? Dr. Barbosa, thank you very much for that question. The debt is still outstanding with PAHO's revolving fund. Negotiations are moving forward to have that debt paid, but PAHO has made the decision to continue to offer technical cooperation to Venezuela as part of the response to the pandemic without and Venezuela can resort to COVAX to buy vaccines, and Venezuela has already received more than 2 million doses. They're about to receive this week the other 6.5 million doses. The price Venezuela pays is the same price paid by all of the other countries. It is a negotiation, a global negotiation that is carried out by COVAX Secretariat with the producers, and this is offered to the countries for the countries to use their own resources in the case of the countries that are self-financed for the acquisition of the vaccines, such as Venezuela. These type of countries make payments, makes payments through COVAX. The vaccines are quite affordable, and they are usually more economical than the price paid under bilateral agreements between the countries and producers. So we continue with our efforts for Venezuela to cancel its debt with the revolving fund. There is no problem for Venezuela to continue to receive the vaccines against COVID-19 with the support of the revolving fund and the COVAX facility. Thank you. Thank you, Dr. Barbosa. We have a question, follow-up questions on the vaccines in Venezuela. Mariana Suquet from Efecto Concuyo is asking, how high is the risk of outbreaks of diseases such as polio and measles, taking into account recent history? Dr. Barbosa, please. Thank you very much for that question. The risk is we see it throughout the countries, as I mentioned at the outset. Even before the pandemic and started in 2015, we have unfortunately seen a reduction in vaccination coverage in several countries of the region, and we also have a reduction of the indicators of surveillance against vaccine preventable diseases. That is due to many reasons. The reduction itself or the elimination of those diseases, oftentimes also there is a reduction of the priority, and health professionals do not think that it is important to discuss with the families the need to vaccinate, and individuals think that it is no longer necessary to vaccinate children because there is no longer a disease, but this is not true. So in our region, for example, in 2019, there was a measles outbreak in Brazil, Venezuela, and in the United States. The United States was able to control the outbreak in 11 months. The same situation was applied to Venezuela, and PAHO has also offered significant cooperation to Venezuela, and we were able to vaccinate back then 8 million children. The outbreak continued in Brazil. It is now more focused in the Amapá state with only a handful of cases, and also in Sao Paulo, but we think that with the efforts that the government of Brazil is implementing, this is an outbreak that will be controlled in a couple of weeks. The risk is applies to all of the countries. That's why we're saying that we need to work by having surveillance on vaccine preventable diseases so as to immediately identify an important case anywhere in the world where transmission continues, and also to implement the proper measures. And on the other hand, we need to continue with high levels of vaccination, not only for the average. The average doesn't allow us to see all of the situation. We need to find the average not only for a province, for a municipality or district, but we need to look into the cities, into the various neighborhoods where those individuals are who are not accepting vaccination, to identify barriers and identify strategies to overcome those barriers and attain equitable, homogeneous, and advanced coverage against those diseases. This is a task and a challenge that we are committed to with the countries now that we are going to have the America's Vaccination Week, to continue in our region to be leaders in terms of the elimination of diseases that can be preventable through vaccination. Thank you, Dr. Barbosa. Now we move on to two questions. The first one is a follow-up on the variants. Felipe Lambias from BBC World. His question refers to Delta Cron that was already detected in countries such as Brazil. Is this a variant of concern for PAHO? Dr. Aldhigieri.
In English, it's coming from the BBC.
Sure.
And
interpretation. Thank you.
Yes. So first, I'd like to clarify that there is no new variant called Delta Cron. This does not exist. And this terminology should be avoided by the media. What happened? A recombination between the variant of concern Delta and the variant of concern Omicron has been recently confirmed in Europe and published by the scientists from the Institut Pasteur network. This event has been first detected in France, and the sequence of the virus shows mostly genes from Delta, with most of the spike protein gene corresponding to Omicron. Similar viruses have been detected in clusters notified in Denmark and the Netherlands. It is still not clear if these viruses come from a common ancestor or if they correspond to different recombination events. So far, only around 30 sequences have been confirmed in these three countries, France, Denmark, and the Netherlands, between January and February 2022. So it's important to say and to remind to the public that recombination is a natural phenomenon already described in different viruses as a mutation mechanism to exchange genomic material. A recombination event might occur when two viruses from the same species but genetically different simultaneously infect the same cell in the same individual. So at the moment, currently, there is no evidence of increasing transmission patterns or changes in clinical outcomes due to this recombination event. Although no specific threat to public health is expected, the genomic surveillance should be maintained and strengthened to early detect any change in the behavior of the virus. So I hope I have answered the concern from the colleague from BBC Mundo.
Thank you, Dr. Aldhigieri. Y tenemos también una pregunta de seguimiento de
We also
Manuel.
have a follow-up question by Manuel Nino from Eje Central in Mexico. He's asking, with the surge in Mexico, how concerned should Latin Americans be concerned about the variant increase?
of Omicron, our position have not changed. And we are aware that the health authorities in North America are closely following the trends of the BA2 sublineage of the variant of concern Omicron. And I'd like to mention again what I answered, I think it was for a question from Dominican Republic, that in the region of the Americas, region-wide, we have more than 95% of the Omicron sublineages pertaining to the sublineage BA1. So BA2 is quite minimal at this moment in the regions of the Americas. Thank you.
Thank you, Dr. Ugarte. Tenemos dos preguntas, una del Caribe.
Dr. Ugarte, we have two questions, one from the Caribbean and one from Mexico in connection with the, thank you, Dr. Aldhigieri. And now next question for Dr. Ugarte. This is a question by Joaquin Quinoco from the Mexican news agency. He's saying that there are several individuals that have completed vaccination schedules in Mexico. They have already received their boosters and they feel safer vis-a-vis the pandemic, and they stop wearing the mask. What should be the recommendation? And we have a similar question by a journalist from the Caribbean. Dr. Ugarte, thank you very much for that question. It is highly relevant for most of us who have full vaccination schedules. The risk of facing severe disease or the risk of death is much lower if we are completely vaccinated and protected. However, that does not prevent infection. And if we do not implement right protection in spaces with high probability of transmission, in particular in indoors or whenever it is impossible to maintain physical distancing, the risk for those who are vaccinated will be lower, but the risk of transmission to unvaccinated individuals due to medical reasons or some other reason that has delayed vaccination may affect those individuals. So when we want to face the pandemic, we have the individual responsibility of protecting ourselves, but also to protect ourselves and the community. So as long as there is transmission of COVID-19 and while the authorities are assessing all of the factors that we addressed before, we need to follow those recommendations. And in the meantime, when we cannot maintain physical distancing, the use of masks, it continues to be the most efficient measure to reduce transmission and also the social, economic, and well-being impact for our community. Thank you. Thank you, Dr. Ugarte. We're reaching the end of our session today. We have a final question for the Assistant Director. Dr. Barbosa, you said that the revolving fund of PAHO will support the acquisition of vaccines for the routine vaccination schedules and COVID-19 vaccination. How does it work? Does the fund buy the vaccines and resells them to the countries? Thank you for the question. The revolving fund is an 42-year-old initiative in the Americas. The fund was responsible for all of the gains in vaccination in the Americas. The Americas was the first region that eliminated many diseases, and it is also the region in which many new and more expensive vaccines were added to the routine vaccination programs for the first time. The revolving fund is a technical cooperation tool that supports countries in all of the aspects from planning to assessment of their vaccination needs so that they are properly supplied for their routine vaccination campaigns. The revolving fund has the participation of all of the countries and territories of the region. Therefore, it can accept a significant volume of requests and presents those requests to international high-quality providers. The revolving fund can only obtain vaccines from pre-qualified providers or also vaccines that are part of the emergency use list, such as in this case of the COVID-19 pandemic. So these are high quality vaccines at an affordable time, because this is a mechanism in which upon receiving the joint request of the countries, the fund may negotiate a lower price with the producers. That is solidarity, but at the same time, it is an important public health tool. If we have a country in the region that is not protected against measles because they do not have the vaccine, or for example, they do not have the polio vaccine, this is not just a risk for that country. This is a risk for the whole region. So that solidarity has allowed the countries to maintain significant access to vaccines in the region. Just as an example, last year, in addition to COVID-19 vaccines that accounted for more than 50 million purchased by the fund bought about 270 million doses of vaccines for the routine vaccination programs such as polio, rubella, measles vaccines, and other vaccine preventable diseases. So it is a mechanism that only exists in the Americas. Starting last year, we have Africa that is attempting to implement a mechanism similar to the revolving fund, and this is a public good in the region that has to be maintained and strengthened. Access to vaccines and good quality vaccines at affordable prices is clearly one of the best tools we have in public health to save lives. Thank you very much. Thank you, Dr. Barbosa. I would like to thank the journalists. We have reached the end of today's session. I would like to thank you all for your participation. We are looking forward to receiving any further questions you may have, and you can also find information at paho.org on the web. And once again, thanks for connecting. See you later.